Okay, now we go to the next one. We have here the hepatitis D. Okay, hepatitis D is your Delta virus. This is considered to be a defective na virus. Basically, it's defective because it's rely on the hepatitis B for its infection. It uses hepatitis B for that to undergo replication and expression of its genomic structure. So we describe here, we illustrate our structure of the virus here as this is the circular RNA as its nucleotide. Then meron siyang hepatitis delta antigen. And ang kanyang envelope ay galing kay hepatitis B na virus. As for the infections, so hepatitis B, hepatitis D, undergo here or try to co-infect with the hepatitis B. So, kailangan sa hepatitis B. Co-infection here, pwede siyang simultaneous. So, na-infect muna ng hepatitis B bago siya ma-infect nito. Or the superinfection is a type of infection wherein the hepatitis D try to infect patients having the chronic hepatitis B infection. So, we have here manifestation. The patient might have acute hepatitis manifestation. So there's also a tendency of the patient here to develop here become chronic hepatitis. And finally, superinfection. So that would eventually result here to fulminant hepatitis. Laboratory test for diagnosis for hepatitis D. We have your hepatitis D virus RNA because this one is an RNA virus. Then we could measure that one through your real-time PCR molecular test. Okay, that's for the active viral replication of the virus. Okay, the next one, we have your hepatitis C. Hepatitis C is your non-A, non-B. So that was the former name of this virus. And basically this one is also, this is, okay, transmitted here by the flaviviridae. But in your PowerPoint, it's actually, okay, it's actually caused here by your, okay, genus Hepavirus, but that's your flaviviridae. Okay, so there are 6 genotypes of this virus labeled as 1 to 6. The most common one, the most prevalent one is your genotype 1. Transmission, we have here bloodborne, little sick puncture, something like that. This is your parenteral. So we have your transplantation, organ transplantation. Okay, and we have also here your sexual contact. Blood, transplacental, organ transplantation, we have also sexual. Okay, for manifestation of hepatitis C, so we have here 20% of patients are having acute hepatitis with a yellowish manifestation. And 20% and 85% of the 20% would eventually become chronic. And therefore, most of the patient here develops a liver carcinoma, and therefore the patient requires to undergo liver transplantation. And we consider hepatitis C as the most common cause of the liver transplantation in the US. But then majority of the patients affected here are asymptomatic. For the laboratory tests, we're detecting for the antibody here, anti-Hep. Ay, wait lang, hindi pala siya. Hepatitis C pala ito. Okay, we have here anti-HCV antibody. And we have also your molecular tests, real-time PCR, your hepatitis C virus RNA, because this one is an RNA na virus. When we have your confirmatory test, you could have your RIBA or recombinant immunoblood assay. So again, this is one of your virus that try to cause your chronic hepatitis along with your hepatitis B and your hepatitis D. Pero ang pinaka-common cause of mortality and morbidity related to your chronic hepatitis would eventually be your hepatitis B. Okay, that's all for this.